So the topic is rabies, which is caused by rabies virus. A rabies virus belongs to the family Rhabdoviridae. It is bullet-shaped in nature. The envelope is present. Genome is single-stranded RNA. It is helical in symmetry, and there are two antigens. The first one is glycoprotein G, and another one is nucleocapsid. Now, rabies virus causes a rapidly progressive, like it progresses very fast, and it is acute infectious disease of CNS, which include brain and spinal cord, in humans and animals, which is transmitted from another rabbit animal. It is almost always fatal. Once clinical symptoms occur, patient maximum dies. Rabies viruses have two types. One is a street virus and the second one is fixed virus. Street virus is freshly isolated. It produces negri body and also affects salivary gland. It is pathogenic and its incubation period is 1 to 3 months. It causes diseases. While on the other hand, fixed virus, after serial passage in cell line, like after several transmission, it doesn't produce any negri bodies, it doesn't affect salivary gland, it is non-pathogenic, its incubation period is shorter than that of a street virus, which is 5 to 6 days, and it is used for vaccination as it is not pathogenic. Now, susceptibility of animals toward this virus. All warm-blooded animals are susceptible, but highest among them are cattle, cats and foxes. While puppies are more susceptible than adult dogs, man and dog are both intermediate susceptible. Now moving on to mode of transmission. Bite of a rabbit, dog or other animal, any other rabbit animal. Now licks on the abraded skin or mucosa. Aerosol that is generated in the bat cave by the bat which is infected by rabies. Person to person is very rare, but it is possible. And corneal and organ transplant. Now moving on to pathogenesis. There is a dog bite. Then the saliva that contains the virus is deposited in the wound. Now it multiplies in the muscle at or near the site of introduction. Now we see that when there is a muscle, a nerve is there and there is a formation of neuromuscular junction here. So that virus attached to the nerves that is present at the neuromuscular junction on nicotinic acetylcholine receptor. Now it spreads centripetally via peripheral nerve towards the CNS. Infection of CNS occurs mainly hippocampus and cerebellum. Now this virus spreads centrifugally and it ends up involving skeletal, myocardial muscles, adrenal gland, skin, salivary gland. Now this virus is shed in saliva of rabid animals which act as the source of infection to other animals. This is here in a pictorial form. Firstly, virus is inoculated. Second, that replication occurs. Thirdly, that virus enters the peripheral nervous system. Then passive ascent via sensory fibers occur. Then replication in dorsal ganglion occurs. Then they reach spinal cord. Infection of spinal cord, brain stem, cerebellum and other brain structure occurs. Then that infection descends via nervous system to eye, salivary gland, skin, adrenal gland and other muscles and organs. This is the pathogenesis. Now moving on to clinical manifestation. The first one is prodromal phase, where there are non-specific symptoms. The earliest symptom might include neuritic pain at bite site. The second one is acute neurologic phase. In this sign of nervous system dysfunction is seen, which can be nervousness, apprehension like speaking problem, hallucination like seeing things which are not there, bizarre behavior, hydrophobia. Hydrophobia could be pathognomonic feature. It could be difficulty in drinking together with intense thirst. Patient may swallow dry solids, but they are not able to drink liquid due to the painful spasm of pharynx and larynx, which leads to choking or gagging. Even the sound or any sight of water is dreaded. Generalized convulsion follow. Death usually occurs within 1 to 6 days due to respiratory arrest, which happens during convulsion. Now, incubation period is generally variable, but average is 1 to 3 months, which is 20 to 90 days. And incubation period is directly related to the distance of the virus to CNS. So, shorter the distance, shorter will be the incubation period. So, it will be shorter in children. Or bite on head, neck, and upper limb will have shorter incubation period, as it is easier to reach central nervous system from there as compared to the legs. Now, in shorter people, or in case of severe laceration, or in high dose of virus. Now, moving on to laboratory diagnosis. First one is specimen collection. It could be through corneal impression, facial skin biopsy, saliva, or during post-mortem, where brain is used as a specimen. Now, method include firstly is virus isolation, then antigen detection, antibody detection, viral RNA detection, or Negri body detection. There is no specific treatment for rabies. Like if clinical signs appear, then disease is almost always fatal, as we have read in the starting. Now, moving on to prevention of human rabies. It is of two types. One is post-exposure prophylaxis, and the other one is pre-exposure prophylaxis. Post-exposure prophylaxis have three components. The first one is local wound care, rabies vaccine, and rabies immunoglobulin. The first one, local wound care, is physical cleansing, then chemical inactivation, then suturing, and anti-rabies serum is given. Second one here, a rabies vaccine is given, which could be of two different route, intradermal or intramuscular. Now, rabies immunoglobulin is given, which is passive immunization. Now, in pre-exposure prophylaxis, it is recommended for the individual who are at higher occupational risk, like laboratory staff that handle these viruses, or clinician that attends human rabies cases, doctors which treat animals, animal handlers, those travelers which moves on to endemic areas. Endemic areas refers to those areas where that pathogen is very likely to cause